Hello everyone, I am Dr. Chinnababu Sunkavalli. I am a robotic surgical oncologist or a cancer surgeon based out of Hyderabad. Today I am going to talk about why it is hard to cure cancer. The minute you hear cancer, you feel that life is cancelled, and what is the reason for that? If you look at the history of cancer care or the therapy in the last 40 years, there has been a significant strides. What was about 25% of cure rates in the 1970s is now more than 50%. So it's doubled in the last 30-40 years. So if to understand why it is hard to cure cancer is a complex disease. There are more than 200 types of cancer. It's not a one disease. In each person's disease as well, there is a lot of complexity. So each broad cancer will have so many subtypes, and they behave differently. No two cancers, even though of the same type, in different individuals they behave differently. So this can be because of the mutations, the myriad of mutations, the different mutations that they are seen in the body. So every cancer is caused by different mutations. As the tumor grows, more and more mutations accumulate. It is not one mutation which is permanent. So every tumor has got a different set of mutations. So a drug which works for one patient might have absolutely no effect on the other. So even within the same patient, some cells respond to a drug and some cells won't respond to another drug. So they are not identical because of the multiple mutations. A specific drug may act on one mutation which may not act on the other ones. So what will happen eventually is that treatment can often kill one type of a tumor, whereas the other ones, they survive even on the treatment. So the point is that treatment can eventually stop working even as you continue to take the chemotherapy or the targeted therapy. Over a period of time, the cells, this is an incredible difficult problem because the cells, the mutations keep on accumulating and they develop a resistance to the available drugs, and they evade cell death, what we call apoptosis, and that's why they make the treatment ineffective. So it happens when the cancer cells develops resistance to a drug, and that's why we have to work constantly to overcome the drug resistance in the people with cancer. So the cancer cells actually, they're really good at staying alive. They know how to escape death. They are very good. They have a controlling mechanism and the arsenal are the tricks to avoid being killed. So cancer cells are very smart in that sense, and there are different strategies to attack them, and many times we succeed and sometimes we fail also. So the treating cancer is very, very complicated because of the lifestyle and also the attitude of the patients also, because each person's body behaves differently to the treatment, and it depends on the blood supply of the to the tumor. It also depends upon the the tumor physiology. It depends upon the fact that tumor also can keep on changing its own nature. The mutations can keep on changing. I think if you look at all this, you understand why it is very hard to treat cancer or cure cancer. Thank you so much for watching this.